All right, I'm going to get started just because we have a lot to cover. So, as people come on in, you feel free to introduce yourself and we're going to kick things off. So, we're here to talk about our youngest learners, our babies from ages 0 to 3. I'm Carrie Gillespie, and I work at EdTrust and I lead our early learning work. And I'm so excited to have Jamie Colvard here from 0 to 3, and she's the Director of State Policy. So we're going to start things off with introductions. I'm going to give an overview of early intervention and the equity issues in the system and give some information about a report that we put out recently. And then I'll pass things over to Jamie, who's going to talk about what we can do right now for infants and toddlers in terms of advocacy. And then if we have time at the end, we'd love to answer any questions. I'll tell you now, we have so much information in our report, so I'm just going to give a high-level overview, but please make sure to check it out. If you click at the top of your screen on the black box that says Notes, you'll see a box pop up on the top right of your screen, and I've listed a bunch of links and resources there that are really helpful for getting state-specific information for you about advocacy for infants and toddlers. So first, I wanted to do a quick poll. I wanted to know how familiar you are with early intervention services. And these are sometimes called Part C services of the Individuals with Disabilities Education Act. So you'll see 4 choices pop up on your screen. You can move that box out of the way if you need to see the answer choices on your screen. So do you feel A, very familiar, somewhat familiar, you're not sure, or not so familiar? And there are no wrong answers. All right. So about half of y'all responded, and it looks like people are pretty familiar. So I will give a broader overview for those who aren't as familiar, but that's really great to know. So here are our results. All right. So these are the reports that we put out recently in partnership with 0 to 3 and with the National Center for Learning Disabilities. And there are 2 reports. The first one is an overview of what early intervention is, why it's important, and what some of the equity issues are that we knew about before the pandemic. The second report is about the impact that COVID-19 has had on these services for babies. And then we also have a video, and we'd love for you to share these videos and reports if you'd like. We think the video gives a good overview of the issue in a quick format. So I'm actually going to show you all the video right now. If you have any sound issues, you might be prompted to turn on your sound or to unmute. Something might pop up, so go ahead and hit that. If you can't hear it at all for some reason, there are captions. So here is our intro video. All right, so that video is available at the link up there in the notes section. So before we dive into the report, I just wanted to level set, make sure we're all on the same page. So when we talk about early intervention and developmental delay, what we're talking about is making sure that babies are on track to meet developmental milestones. So that is things like gesturing, when we expect kids to start gesturing. I put some examples here for a 1-year-old. So at 1 year old, we expect that most 1-year olds will be able to get up into a sitting position without help. We expect most 1-year olds will play along to peekaboo. If I point to something, we expect most 1-year olds will also be able to point to something that they're interested in, or poke an object. So it's things like this that most babies will hit these milestones around the same time. And when there's a pattern for a baby of not reaching these milestones, that's when an evaluation might be appropriate to figure out if they do have a delay in their development, in which case it's really important to connect them to services that can help make their development as happy and healthy and on track as possible. So there are three main steps to this, but this looks pretty different from state to state. But first, there's screening, which is all about identifying the babies that might benefit from these services. So there's a law called the Child Find Law. States are required to locate any baby who might need services. And these are the types of things that, when I bring my toddler to the pediatrician might give me a checklist, and I'll check off, how many words my baby says, whether they're gesturing, things like that. Sometimes this is done in preschool settings as well. Nurses might look out for developmental milestones as my baby's interacting in a doctor's office. That's screening. Then there's evaluation. So if a doctor or a teacher has a concern, a baby and their family will be referred for an evaluation. And I'll talk a little bit about that in a minute. And then if the evaluation determines that that baby does meet the criteria for having a developmental delay, they will be connected to these early intervention services. One note about these evaluations, we're not giving babies scantrons or having them sit at computers and take tests. To a baby, this feels like they're just playing with a cool new stranger and their parent is in the room. And I used to give these evaluations. Really, my goal was to make the baby happy and feel like they're just playing with me, toys, blocks, dolls. And I'm talking to the parent to talk to them about what a typical day looks like for them and just getting as much information as I can to assess the baby's development. So what is early intervention? Every baby, every child ages 0 to 3 who has a developmental delay is entitled to these services. And it's important to note for this age range, this entitlement is not just for babies, but for their families to nurture the entire environment and give the supports that that are needed. So this can be anything from physical therapy to counseling for parents who are interested in that. A lot of speech and language therapy happens to get language and speech developed, nutrition support, transportation, all kinds of things based on the specific needs of a particular baby and their family. I'm curious to know, do you all know any children who have received these services before age 3? Maybe it's yourself when you were a baby. Maybe it was a friend, a family member, or at work. Let's see. And there is no option D. I just can't not give you that option. All right, so we have a good number of people who do know babies who've received these services. Some people not sure. All right, this is what we got. Great, so some people know babies who have received these services. So what do we know about equity in early intervention? Well, we know access is limited for babies of color and their families. So compared to their white peers, white babies with developmental delays, Black and Latino babies face greater barriers to accessing these services. So I wanted you all to take a guess. How much less likely do you think Black and Latino children are to be identified for early intervention services than their white peers? How much less likely? I'll give you another minute. Couple more seconds. All right, we got a little over half of people responding, so let's see what we got. So people guessed 57% less likely. Let's see. It's actually babies, Black and Latino babies in this large study we looked at were 78% less likely to have their need for early intervention services identified. So clearly, there is a major equity issue with accessing these services. We also know that babies from higher income backgrounds are 26% more likely to have that developmental screening than babies from lower income backgrounds. And these rates all vary a lot state to state. And I'd encourage you to check out those resources in the notes section of your screen where you can find your state in the 0 to 3 resources and in the Prenatal to 3 Policy Impact Center resource that I put up there. You can find your state and see how your state is doing. We did a survey along with 0 to 3 and the National Center for Learning Disabilities. And we sent the survey to the state coordinator who's in charge of early intervention services in each state. It's a big job. It's a job for more than one person, but there's often just one person doing this job due to funding restrictions. We heard back from 29 state coordinators, and we asked them specifically about how COVID-19 had impacted services for Black and Latino families, for families with limited English, and for families with low incomes. And what we found was that referral rates had dropped. So far fewer babies were being referred for those evaluations by their doctors and teachers and nurses. We found that wait times from the time a doctor referred a baby for an evaluation to the time that the baby actually got evaluated, that time increased in several states. And then we found that the service rate, so how often families were accessing these services, meeting with professionals to provide the services, that dropped in several states. But we didn't hear from several states also. So the data was very variable, and we don't know what was going on in a lot of states. And importantly, our other big takeaway was that there just wasn't enough data that would allow us to monitor and measure equity. Most states didn't collect data that was specific to Black and Latino families, to families with limited English, and for families with low income. So we don't really know if there were or how big there were disparities in providing services for these families. And the report goes into just exactly how many states had data on these different topics, so you can look for more details there. The good news is we asked states about bright spots, what's been working well during the pandemic. And, we definitely heard that people were working really hard to get these families services, working with what they had, the limited resources. So this actually forced some states to have to update their technological capabilities. So they ended up getting better technology in the states, which in turn increased family engagement if they were better able to access working with families virtually. Of course, a huge roadblock that we heard about was working with families who didn't have internet access during this time. That was really tricky. It also increased family engagement in some states in that some families had better opportunities to meet with practitioners when they could meet virtually. It was just logistically easy for them. Of course, the flip side is that it was much more difficult for families without reliable broadband or who had to take on extra work during the pandemic. And then we also heard that there were some good collaborations going on during the pandemic where states were sharing with each other what was working, and it was kind of forcing people to come together and share ideas in ways that they hadn't before. So those were some bright spots. One of the bright spots that we had followed before the pandemic was in Delaware. They did something amazing with their screening process to try and screen as many babies as possible. And so we just made a video about this. It's not released yet, but we wanted to give you a sneak peek about what Delaware did before the pandemic. But I think it really will have ended up helping them during the pandemic as well. So let's take a look at that. And again, hopefully you all will be able to hear it, but it does have captions if for some reason you can't.
Delaware Readiness Team. In some ways, this all started with a concerned grandma who shared her problem with the Delaware Readiness Teams. It was tough for families in Delaware to find out if their child was reaching expected developmental milestones and to get support if they weren't. Screening services were only provided to children in certain childcare settings. And unfortunately, the majority of Delaware's babies and toddlers were missing out on vital services because they weren't enrolled in those programs. So when a concerned grandmother asked at a Kent County community event how she could get her grandchild screened, since they weren't attending one of the child care programs, advocates from Delaware Readiness Teams realized they had a problem. Listening to the people closest to a problem is what leads to the best possible solution. For leaders in Delaware, that meant listening to families, child care workers, and local school districts that coordinated screenings about barriers to accessing early intervention services. Services were siloed, access was limited, and when a parent, guardian, or child care worker attempted to find information on developmental screening services, they entered a dizzying maze of disconnected websites and confusing processes. The more Delaware education leaders learned, the more they realized they urgently needed to streamline early intervention identification and services in accessible, equitable ways. To solve this, Delaware Readiness Teams launched a new initiative to help all young children in the state get early, easy access to developmental screenings and possibly services that support their growth and development. Through partnerships with the Department of Education's Office of Early Learning, local school districts, other state agencies, technological innovation, and a network of readiness teams around the state, any parent or guardian can now get developmental screenings and, if needed, resources and services to support their child's development. Through online portals, families can be connected to their local school district or state agency and answer a series of questions about their child. The district or state agency then works to assess a family's needs and connect them to services. The success of the new initiative relies on committed local leaders who are dedicated to increasing access and helping the state's youngest children thrive. Next up for Delaware is expanding awareness about the benefits of local teams designed to support families as they navigate the process and encouraging the use of the one-stop shop for screenings. Clearly, Grandma was onto something. Learn more about how Delaware is increasing equity and access by checking out the website at www.delawarereadinessteam.com/developmental-screenings and visit edtrust.org for more on the importance of early learning services.
So that's Delaware's awesome story. Leanne, thank you so much for sharing the link to your amazing program. The way that they streamlined everything, I can't understate how helpful that is for families to figure out what to do and what steps to take next. So please go check out the link that Leanne shared in the chat as well. So in our report, we have several recommendations for states. And when you talk to state policymakers about this, I think we can't assume that they understand just how profoundly impactful early intervention services are for a child's whole lifespan. So it's important, first and foremost, to communicate the ripple effect that these services have on a child's preschool age, elementary success, and on and just how profoundly it can support whole families. But beyond that, we have several recommendations for state policies. So first and foremost, they must collect better data that's disaggregated by race and ethnicity, home language, income. We hope states will learn from bright spots. We hope that they'll share bright spots with one another. We want them to strengthen those practices for the child find law that's all about identifying every baby who may be eligible for services. And so the way that Delaware did that is something you can share with your state. We really need states to give better guidance to their coordinators of early intervention. You'll see in our report, I didn't have time to get into it today, but several states didn't provide adequate guidance in terms of how to communicate and serve families with limited internet access, families with home languages other than English, and other issues that that people really needed guidance on. And then another big one is the ripple effect that this might have in the coming years. So babies who aren't accessing services now, once everyone finally returns to school and childcare and doctor's visits on a normal basis, there might be a big increase in referrals for these services and for babies who are identified as needing these services. And that might have a ripple effect in the coming years in terms of how many children in preschool need special education, how many children in early elementary school need special education. And there's a huge shortage of special educators right now. So that's something that states really need to consider. The report has several more recommendations, but I'll leave it there. And we will have time at the end for questions and answers, hopefully. And now I'm really excited to kick it off to Jamie, who's going to talk about her organization, 0 to 3, and their Think Babies campaign and the awesome work that they do advocating for babies.
Great. Thanks, Carrie. Hi, everyone. I'm Jamie Colvard. As Carrie said, I'm the Director of State Policy at 0 to 3, and I'm really excited to be here with you all today. For those of you who aren't familiar with 0 to 3, we are a nonprofit based in Washington, D.C., although we have staff all over the country. I'm in Oregon. And our mission is to ensure that all babies and toddlers have a strong start in life. I sit in our policy center. So the Policy Center is a nonpartisan, research based resource for policymakers and advocates, really trying to help policymakers and advocates and those that work with them understand the unique developmental needs of babies and toddlers and how policy and systems can really help support healthy development. So I'm going to sort of step back to the kind of big picture look. Um, so why do we need to focus on babies? Often when we're doing policy work, when you say early childhood, the first place a policymaker will think is maybe elementary school, or then maybe they'll think of pre-K, but often they don't really understand what, or they don't even think about what babies' needs are. So the place we usually start is why focusing on babies is important. And we lean on the brain science here a lot. So I'm sure you've heard this before, but I always start things like this by restating what the science tells us. So we know that our brains grow faster in the first few years than at any later point in life, forming more than 1 million new neural connections every second. And when babies have nurturing relationships, positive early learning experiences, and good health and nutrition, those neural connections are stimulated and strengthened, laying a really strong foundation for all future learning and development. But when babies don't have what their growing brains need to thrive, they don't develop as they should. And that can lead to lifelong developmental, educational, social, and health challenges. And so it's really important to start early supporting families and babies at the beginning. And, like Carrie was just sharing in the context of early intervention, we know that opportunities to grow and flourish are not shared equally by all babies and families. And that is reflecting both past and present systemic racism and barriers to critical resources. Racial disparities exist across nearly every measure of well-being, from health to economic security to access to early learning experiences. And even before the pandemic, 42% of babies lived in families without enough income to make ends meet. And that's just not acceptable. And so we usually come to this from a place of saying that if our nation is to thrive, we really need to build for the future and ensure that every baby has what they need to meet their full potential. So, what do babies need? So this slide shows 0 to 3's policy agenda. We know that all young children need good health, strong families, and positive early learning experiences. And we as an organization are focused, sort of on a holistic look of what babies and families need. We know there's not one silver bullet policy or system that's going to solve everything. And so we really make the strong case for looking at families' needs holistically. So, what falls into these areas? We talk about how important it is for young children and their parents and family members to have insurance coverage, to have access to physical and mental health services, prenatal care, primary and preventative care, access to services and supports to help parents understand what development looks like at this age and how they can support it. Um, and building on what Carrie was just talking about, connection to developmental screenings so that issues can be identified and addressed early, and having that whole connection to systems along that way from screening to referral to receiving services. Um, Within the strong families bucket, we're really talking about programs and services and systems that promote families' economic security and inclusion. Everything from minimum wage policies to insurance to paid family and medical leave and paid sick leave, looking at the child welfare system and having services designed to really support families and think about what's unique about babies and that rapid time of development, looking at home visiting services and how those can be supportive of families. And then in that last bucket of positive early learning experiences, really helping policymakers understand that learning begins at birth, and that it's really too late if we wait until a child gets to school, that really all young children, all babies need access, if their families want it, to high quality childcare in a variety of settings that meet parents' needs, whether that's family childcare homes or a childcare center or family friend and neighbor care. We talk about programs like Early Head Start, which is a comprehensive 2-generation program supporting infants and toddlers and their families. And then again, the early intervention system. Now, I just gave you a long list of different programs and fundings, and we know that it's much more than sort of a menu of programs that we need, right? We also need those services to be high quality, culturally responsive, inclusive, accessible, and affordable. And they need to be integrated into a system that families are able to navigate and able to access. And it looks different in communities and states based on the context and the needs. But what's most important, I think, is that the system is really centering families and understanding what they need and how they access it, that it's not a top down designed based on what a policymaker might think families need or should do. Um, So, strong policies and systems can really be a tool to disrupt and dismantle institutional racism, promote equity, and ensure every child gets a strong start. And I wanted to just briefly mention a couple resources that can be helpful in looking at this. One is our State of Babies Yearbook. This is one of the tools we use to help policymakers understand how babies are faring in their state and to use data to shape decisions that they're making about policies and funding. So it presents a national and state by state look at how babies are doing across 60 indicators of well-being. The map that you see up there on the slide is sort of the overall ranking based on all of those 60 indicators, but I'll flag that states are wildly all over the place on indicators. So a state that might be doing really well in one area has a lot of room for improvement in another. So if you're interested in digging into your state's data, I encourage you to do that at the website that's in the notes. But the main takeaways from doing this state by state analysis are that where a state, what state a baby is born in really impacts their chance for a strong start in life. By nearly every measure across all states, children living in poverty and children of color face the biggest obstacles, such as low birth rate, unstable housing, and limited access to quality early learning experiences. The report also highlights major disparities that begin before birth, especially for Black children, which are driven again by systemic racism and social injustices. And so when we're working with folks in a state to think about policy priorities, we take a look at this data and data that they have within their state and communities and really help them to think about what are the root causes that are maybe leading to some of these inequities that they're seeing in their data, to examine what ways past and present policies are really fostering that, and try to look at sort of the root causes of those as they're developing policies to address them. The other thing that we really try to focus on in our policy work is centering families um, in deciding what needs to be focused on. So too often the policymaking process isn't authentically including those who are going to be most impacted by it. And so recognizing the expertise that families and direct service providers have based on their lived experience, and organizations like 0 to 3 and advocacy partners that we work with in states and communities can really use our resources to create ways for families to be more involved and to really shift some of the power for making decisions to them. And in the notes, there's a link to an article we just released that really digs into how states are doing this. So I encourage you to take a look at that. Okay, so that was sort of big picture what 0 to 3's policy agenda is and what we know babies need. I want to get a little more narrow and share some opportunities right now that there are to really support policies and systems for babies. So, like I said earlier, infants and toddlers are sometimes an afterthought. And so, a key role that we play when we're working with states is to really highlight their unique needs and help states both think about what they might do that's very specific to infants and toddlers, but also how infants and toddlers are showing up in broader early childhood or family support efforts that they're working on. So, this could include thinking about what babies need when your state is going through their budget process. It could be if your state is expanding preschool, think about ways that you can increase support for infant toddler childcare in the context of that preschool expansion. Um, a big opportunity right now is thinking about equitable implementation of the American Rescue Plan Act and other COVID relief funds that have come down from the federal government to states. So, on this slide, I just listed a handful of things that the American Rescue Plan Act included funding or provisions for. Now, most of them are not specific to infants and toddlers, but all of these areas have opportunities to think about what babies and their families need. So, as a state is thinking, for example, about childcare and supporting existing childcare programs and addressing childcare deserts with their um, childcare funds. They can think about what do they know about who is and isn't being served pre-pandemic? What do they know about who was most infected affected during the pandemic, and how can they make sure those resources are used in an equitable way. Um, Another really exciting provision in the American Rescue Plan Act, from our perspective, was the option for states to expand Medicaid coverage for postpartum for 12 months. Many states had been sort of exploring an option of doing that, but it was a much more burdensome way previously. And so we're very excited that some states are thinking about how to move this forward, because we know that parents often don't have coverage after 60 days after a new child is born, and that that postpartum period is much longer when things can come up. And so that is a really exciting option. Interest of time, I'm going to keep moving and then I'll open it up. So in addition to supporting states to think about implementation opportunities of the things that have already come down from the federal government, we are spending a lot of time right now thinking about opportunities at the federal level. So I'm sure that many of you have been hearing in the news all of the back and forth around the reconciliation bill that's currently in Congress, and the Build Back Better Act, which includes many things for families. There's three pieces that we are really excited about. The first is paid family and medical leave, which would ensure every newborn or newly adopted baby has a meaningful amount of time to bond with their caregivers. The second is a childcare entitlement that would ensure that when parents are in work or training, babies have quality care that won't break the budget and that will sustain providers through appropriate compensation. And then third, an extension of the expanded child tax credit that first came through in relief funds, which has given an incredible boost to families and reduced poverty for young children hugely. Um, and so, if you've been following the news, you've probably heard a lot of conversation about the top line number of this act and what's in reconciliation. Um, but what we're trying to do is really help policymakers understand, not focus on the overall number, but focus on what this really means for babies. We're very worried that there might be cuts or removals of some of these important family focused pieces as those discussions continue. And so the message that we're trying to make clear is that babies growing brains can't choose between the things they need, right? And neither should Congress. So we really need to have them take this full holistic look at what babies need. And so through our Think Babies campaign, we've been doing, as you can see from these pictures, our campaign around Build Back Better is for Crying Out Loud, just past Build Back Better, with lots of cute crying baby pictures. So what can you do? I just threw a lot of things at you. I think, you can, if you're not focused on early childhood, if you're primarily focused on older children or other issues, maybe consider joining or going to an early childhood coalition table and bringing your perspective there. Or bring the baby voice to a table you sit at where it's not already reflected. Oftentimes, there are things that we don't think of as the core early childhood, like housing, which is critically important for babies, right? But those people aren't always talking to each other. So trying to make those connections and really think, what does a family need? Um, Think about where you have opportunities to shift power to families to be more involved in policy and advocacy, and educate both state administrators, who hopefully will soon have a lot of these new resources from the federal government to implement, and policymakers so they know what is most important. And then if you want to get involved in our For Crying Out Loud campaign, there's the link here where we have lots of messaging and support, so you can email or tweet your members of Congress about that, or you can sign up for Think Babies to get information going forward about advocacy opportunities or policy resources. Well, I'm going to stop and
Thank you.
hand it back.
Thanks so much, Jamie. That was really, really helpful. I really encourage people to sign up for Think Babies, and the link is up in the notes. Not only is it really informative, super actionable stuff, but you receive pictures of cute babies on a regular basis. So it's great. We have an excellent intern at EdTrust right now in early learning, Antoinette Waller from the University of Maryland, and she's been monitoring the chat for questions. I think, Sarah, we addressed your question, at least in part, about some state or local policies to reduce barriers. Some of the things that Jamie was talking about. If anyone else has questions, we have about 4 minutes. We welcome your questions. And as we wait for one to come in, I will just say in the notes, I also put an article down towards the bottom that I wrote. It's about balancing universal pre-K with infant and toddler early learning. That article is really important because if pre-K expansion is done carefully, it can be really great for infants and toddlers. If it's not done carefully, it can have unintended consequences that actually make it harder for families to access care for infants and toddlers. With too many of the resources are focused on 3 and 4-year-olds, it can sometimes squeeze infant and toddler care. So that's a great explanation of that issue, and just something else to think about when you're thinking about your state's whole approach to early childhood, because we want to make sure all the kids from 0 to kindergarten are being served. And Leanne, thank you for sharing the bill related to the initiative. That's really exciting. Any other questions folks have? I hope you'll check out those notes. You can copy and paste them. All right, so in my state, we're really struggling to get data from the state on early intervention services delivered. Are there any states that successfully advocated for more data transparency? That's not something I know offhand. Jamie, I don't know if you...
I don't offhand. I will say that I once worked with a smaller county that dug it, like they did a project where they dug into that. But I don't know of a state that's done it at that level.
Oh, and Leanne, is that related to this data transparency in Delaware? Or it's data related to funding equity, it looks like. Well, yeah, and I don't have a good example either, but I'd be interested to know the answer to that question. So I'll do some digging and I will share that with you, Laura, if I find that. Really good question, because that's what it's all about, is the data transparency. Oh, that's great. In Delaware, the legislation that Leanne shared forced the Department of Education to provide data related to student funding. Yeah, it's a hard question. It's one of those questions we're constantly asking and pushing, but it's really hard to get transparent data. And especially even just data about numbers in terms of how many families are accessing things from the very beginning of referrals, but then want data disaggregated by race and ethnicity and home language and all the things we talked about, that's even harder to find. And that's something that we're pushing for in our recommendations, is for both federal and state requirements that would require that type of disaggregation so that we can really identify disparities and target funding better. Any other questions? We got 1 more minute. Well, I just want to thank Jamie again so much for sharing 0 to 3's work with us. I want to thank Antoinette, our awesome intern, and I just hope you all take Jamie's words to heart, to bring baby issues to places where people aren't talking about babies. People often overlook babies, and like 0 to 3 says, we want you all to think babies and to help Congress remember babies as well. So thanks so much for joining us, and I hope you enjoy the wrap up to boot camp. Thanks, everyone.